conduct a separate discussion. Hello, everyone. Good evening. My name is Koustav Chatterjee. Welcome to another session powered by Voice of Healthcare. I'm a principal at Frost & Sullivan, and today I have with me Mr. Raul Kallo. He is the founder and CEO of BBO Health, one of the leading healthcare information technology that offers progressive capabilities to payers, patients, and physicians in Europe and in India. We'll talk about the future of healthcare in today's discussion, meaning we'll explore avenues, opportunities, and areas through which healthcare information technology can contribute meaningfully to the healthcare ecosystem overall. And in that regard, I would like to formally welcome Mr. Raul Kallo onto the discussion.
Thank you. Thank you very much for having me.
Thank you for your time today. And as we mentioned earlier, let's have a discussion around the future of healthcare in 2021. And obviously, we'll expand the scope of this discussion to the next decade as well, because the topic is obviously the future trends in healthcare for the next decade. So we'll start with the trends that are relevant today in 2021 and gradually expand into other areas which would be relevant in the next 5 to 10 years' time. But before we talk about specific trends and drivers, I'm very curious to know about the history of VIVEO Health. So could you tell us more about your company, how you incorporated it? And it's a new company. I think it's co-founded in 2017, but then you also entered India very soon. So what has been your learning and what are your future plans for India and Europe?
Yeah, basically, how VIVEO Health got started was that I wanted to disrupt the traditional private health insurance because my background is more than 20 years in insurance business, representing global corporates from US, from Europe, from everywhere with their insurance needs. And then that's why I really well know how to optimize insurance contracts. So and I thought that it would be great to do something more impactful and help people on the private health insurance side, so to make it more affordable and user-friendly. And then how it all started, it's basically I started to work with inefficiencies and noticed that these insurance contracts are kind of like a broken credit card. It sometimes works, sometimes doesn't work, and there is a lot of cost and always getting more expensive. So my idea was then that why don't we do first consultations digitally and then build up a network of offline partners, and then private health insurance is the one that covers the bill, and it's going to be like end-to-end client journey for our customer. And then this is what we started to do, and it's a very complex development. We started to cooperate with a Fortune 500 company from US, Amtrust, and then went live in Estonia last year. So there was a lot of preparations before. And then what we noticed was that actually it was like, super efficient, and clients really liked it. And then about 80% of the cases our doctors managed to solve digitally through a chat, through a video call, and then everything in data secure environment. And then when this COVID outbreak was, then I'm sitting in the roundtable of this global health tech leaders roundtable organized by McKinsey. And from there, we got these updates that what is the global need for the telehealth. And suddenly it raised from almost non-existing percentages to 77% in the world. And then we thought that actually the technology that we have in VIVEO Health for our own doctors this is something that whole world really needs. And then we thought, okay, let's try to repack it and make it available for the doctors free of charge globally. And then what happened was that in 2 days we got doctors from 42 countries who started to use our platform. And then for us, as you most likely know, that Estonia is world #1 in digital health. So I absolutely top things that we do there for many years, and also most digitalized country in the world. So it kind of made a lot of sense to go and help a lot of people around the world. So now I'm physically in Delhi in India, and tomorrow already Mumbai. So a year ago, I didn't have a plan to enter the Indian market yet.
Okay. Sounds fascinating. I am very optimistic about the future of digital health in India as well. COVID-19 has really accelerated the growth at which physicians, patients are adopting IT enablers to stay in touch with each other. We have also seen that Ayushman Bharat, which is a major insurance policy by government of India, is being implemented across many states, and the role of technology in future to ensure that the insurance program is effectively optimized and governed would be creating a lot of opportunities for healthcare information technology companies like yourself. So I'm really glad that you're taking that early movers approach of coming to a country where the growth is right now centered, and we expect as an analyst firm that such phenomenal growth story that we are hearing during COVID-19 in regards to telehealth, virtual health, how physicians are opting progressive AI-enabled clinical decision support technologies to better diagnose patients who are at risk of various chronic conditions are going to create a new benchmark for emerging markets in India moving forward. And I cannot really wait to see how VIVEO Health explores and capitalizes on those growth opportunities and expand its footprint in India. Moving on to the next topic around the role of technology itself in patient-provider interaction. You mentioned that your company has offered very progressive Western capability-enabled technology products, which physicians and patients can use today to benefit. Could you tell us more about your vision moving forward, how your technology will ultimately help patients improve their outcomes, and also at the same time will support physicians in collecting patients' data at scale so that they can use that data and create actionable workflows for those patients across the care continuum?
Yeah, definitely. I believe that health research and technology, should work really together. We have a good example from Estonia that since 2008, every Estonian has his own digital health record. So that's a big step. The next big step from Estonia was that 2012. We got a digital prescription that every doctor who writes a prescription, it goes automatically to the pharmacy, and we sign documents digitally, do a lot of things digitally. So we are very much used to that. So in terms of healthcare, even when we launched in Estonia, we're a little bit skeptical how much people actually like to communicate with the doctors through video or through chat. And now we see that it's 80% of the cases we saw digitally, and most of them via chat. So how I see digital technologies developing, first of all, in the world there is a need of doctors everywhere. So for doctors, we are a perfect tool to save their time so that they can focus on helping patients. We can already see that one doctor using our technology can service up to 20 patients in 1 hour, which is much more than in any physical practice. So my view is that healthcare should be, data-driven and personalized, and this is how it can go so much more efficient. So when we are talking about like patient health profile, then we have health record, but also there are tons of wearables that watches, rings, everything. that actually gain a good information that we can use and to provide it simplified to the doctor so that they can make much better decisions. And then obviously, like VIVEO platform at the moment, what we have in India, it enables doctors to collect payments online, do prescriptions, write out send to the labs. We have a good cooperation with SLR Diagnostics, Farm-Easy, so they can take their whole offline practice to online. So especially in COVID times, that what we saw, many of the doctors are scared of COVID as well, or they are suffering in chronic diseases, and it's very dangerous for them to go to the physical practices. So, but they still want to help people. So with our technology, they can easily do that. So I think there are a lot of super exciting developments on the way. Because now, when we launched in 42 countries, what we noticed, we provided a lot of things that it was so technology was very complicated that we had in a way that doctors are often not very tech savvy people. So where we put our focus now is to simplify everything. And now our platform is 10 times easier than Zoom. You don't need to download anything, and you can start really servicing your patients in the on the best way and best platform. So I think it's going to be super exciting where the healthcare is going to be in the next 5 years' time.
And this is a fascinating story again to learn about your capabilities across so many countries. And I'm also very happy to know that you're planning to prioritize your products for the Indian market, which is so important because every market is different in terms of their need and appetite for healthcare information technology solutions. Also, for the fact that we have homegrown solutions, startups that are built and launched in India, and also big multinational companies, the likes of HCL, Infosys, all those companies are also actively investing on technology products to launch solutions in India or outside. And to have a capability which is already tried and tested in some of the most mature markets like US and Estonia, to come to India with those outcomes driven work is really going to make the case in favor of you whenever you are going to have a conversation with your target audience. And the fact that you tried and tested this solution in some of the most competitive and mature markets would really turn the tide in favor of you. But also, I have to ask you another follow-up question in regards to the answer that you just gave me, is the fact that how you're approaching the Indian healthcare market. I have interviewed people in the past on behalf of Voice of Healthcare, where people came from the primary healthcare background. Some people came from the large multi-speciality hospital background, and they all had different perspective around how they want to invest on technology and leverage it for the betterment of outcomes. So when you approach the Indian healthcare marketplace, which is very complex, diverse, and pretty huge, to be very honest with you, how do you expect to kind of prioritize your strategy? Where do you want to start? Do you want to start at the primary healthcare space where there are a lot of independent chambers and clinics where very important physicians are practicing, but then they are not using technology at all? Everything is done based on guesswork, and they are struggling to manage administrative, financial, and operational activities as well at a clinical level. Or you want to start with the hospital market where you know that it's a pretty large market and lucrative market in terms of investment as well, and you can at the same time work with hundreds of physicians, and probably from business perspective that will benefit you. So what has been your strategy?
So basically, how we enter Indian market as well is, of course, key is to have the right people, and we have super strong CEO with a pharma background, Prasant Mohanty. So he has built up a very strong local team here. Even in our Tallinn office, our chief revenue officer is from India. our digital marketing guys from India. So and you know, funny fact that I have noticed is that wherever I go, whether it's in San Francisco or whether it's in London or whether it's in Spain, in every top hospital there are Indian doctors. So we are strong believers of Indian healthcare and the quality of healthcare people in the healthcare. So how we entered India as well, we started to do partnerships with diagnostic chain, SLR Diagnostic, then PharmEasy, then we have Dockery partnership on marketing side, and many more. So first, what we do is that we create an ecosystem so that first doctor can do whole patient journey on our platform. So how we started to get doctors was first through a little bit of online marketing, and we saw that actually everyone likes us. And then now most of our doctors are coming in through our partners. So, but very soon in March we're gonna launch a marketplace solution that enables cut off for the hospitals, cut off all the patient no-shows. So with our smart payment system, you know, it enables patients to book offline appointments as well, and then it's going to be all prepaid and very simple. So basically, we see that there are a lot of need from, for example, from psychologists. They are using our platform a lot, but also GPs and you know, it's even kind of like, you know, to be honest, difficult to tell what is from where we get most of our doctors. We have signed a lot of partnerships with also hospitals who are eagerly waiting, you know, when we launch, you know, more technology on Indian market. So super exciting times ahead.
Yeah.
And also one thing that where we can help and where we will help is that we create this online academy how to hold good telehealth sessions for the doctors. And you know, we've been doing that through the webinars already almost half a year. So soon there will be a nice online academy, so every medical practitioner can see that how they can benefit from the technologies.
Yeah, completely agree with you. And I think one of the other areas that I wanted to emphasize on the call today in terms of opportunity in India is digital therapeutics. I've been working with a lot of homegrown digital therapeutics companies like Wealthy Therapeutics, for example, where they are creating specific IT-enabled, clinical workflows for a specific disease area like diabetes, for example, and they are offering all diabetic patients a very data-driven approach to manage their health condition. I know that in the back end, they're also collaborating with major pharmaceutical companies in India, and together they're offering educational support and clinical interventional support to all the patients suffering from diabetes, so that first of all, the patients suffering from diabetes can send their data points directly to the providers without visiting the hospital or the clinic every week or every 3 months through technology. Second, when the data is available, the digital therapeutics companies are correlating those data against a specific subset of patient populations data that had similar conditions, and creating meaningful, actionable results for clinicians to refer on when they treat that patient again, or renew or plan to renew the prescription or offer a new medication to that patient. So digital therapeutics, I think, targeted to a specific disease area would have tremendous potential in India moving forward. And as you plan to enter the market and grow your business in India in years to come, I think this is one opportunity areas worth exploring, or at least considering in our perspective and standpoint.
Yeah, definitely. That's a very good idea from me.
Yeah, and we can talk about that later on at a separate conversation as well. But then I just wanted to highlight that digital therapeutics, real world evidence, which is again the data that you're collecting from your patient subset, how you're leveraging that data to create actionable intelligence for clinicians, insurance members, and regulators would also have very good potential in years to come in India. Now, moving forward with the discussion on the future of healthcare in 2021, one of the areas that we also want to explore is how Indian technologies can cross the border of the country level barrier and offer capabilities which can be leveraged across the world, right? So, cross border collaboration through digital health technology is a reality in Western market. In Europe, we have seen a company, let's say based out of UK, is very easily offering capabilities in Italy, in France. But same is not happening in India. But we are optimistic that with VIVEO Health and similar technologies, that could slowly be a new reality in India. So, what is your perspective around how digital health solutions can pave the way for cross-country collaboration and
Yeah, definitely. This is what I see. One of our super interesting as one of our super interesting challenge. The technology that we have enables also take medical practices cross border, which means that the doctors can.
hello, can you hear me, Raul?
Yeah, I can hear you. You got it disappeared for a while. Yeah? So yeah, definitely.
Viewers, I think we are having a technical difficulty. Please bear with us. Raul, can you hear me now?
Yes, I can hear you.
Okay. Did you get the last question I asked?
Yeah, I got it. Yeah,
Yeah.
we see our technology as a super solution to take offline clinics here in India, not only online but also cross-border. So cross-border medicine is something that where I see a lot of future because people want to have the best doctors. And then let's say there is a medical consultation with a beauty clinic in India with a patient in Estonia, Latvia, Lithuania, Finland, US, you name it. So in old times, it meant that when I have my consultation, then I need to fly to India and have a doctor appointment, and then discuss whether I need this kind of operation, etc. Now we can do basically first visit online, and after a surgery, all the following visits online as well. So that enables to save a lot of money for the end users, for the people who really need this help, and then also that enables these top doctors that you have in India to get the best international clients who are willing to pay a lot of money for your medical services. So we see it as a very good and huge opportunity, and our current technology enables collect payments from all around the world from the clients. So it all happens on VIVEO Health platform on the same link that patient will get, and then they don't need to do complicated bank transfers or anything like that. Everything is happening in seconds. So this is super exciting, I would say, and it will definitely give a good growth for the private top medicine that you have here in India.
Yep. Yeah. Absolutely. In fact, I remember exploring the idea of targeting non-residential Indians from India through a digital health technology. I mean, I know that there are many. I mean, I have family members abroad, staying in US and Europe, who actively want to come back to their house physician back in India. And historically speaking, 5-10 years ago, they didn't have that opportunity to connect with a physician in India with whom he had been getting kind of consultations done for years, but because he moved abroad due to work, due to marriage, etc., they were not able to connect to that same physician due to again, non-availability of technology enablers. But now, with the invention of digital health solutions that can be scaled across different countries, that opportunity exists. And I know that there are thousands and millions of NRIs across the world who are trying to come back to India. Medical tourism was a very thriving industry, but lockdown really disrupted that. There were a lot of restrictions for patients to come to India, but then Ministry of Health, Government of India eased some of those limitations and restrictions by allowing emergency travel for medical purposes. But then I do believe that people who are getting surgeries done in India and going back to their home countries would need that technology platform to stay in touch with their provider for a longer term period so that they can take care of their health and remain healthy and avoid readmission. With that being said, we have 4.5 minutes left, and I would like to take the opportunity to also kind of talk about Frost and Sullivan's latest report on the global healthcare outlook for 2021. Frost and Sullivan, being one of the leading market research and consulting company, tracks the healthcare and life sciences practice very closely. We have 5 different verticals within the healthcare and life sciences domain. We call it pharmaceutical, next gen diagnostic. We have advanced medical technology. We have medical imaging, and I'm part of the digital health team. And every year, all of us come together and share our opinion and experience around the future of healthcare. And this year, when we teamed up to think about the future of healthcare, especially at the outset of COVID 19, we had to really reinvent the way healthcare would be reimagined in future. And we thought that it's time to have a look at what the future holds for us. There are a few trends that we have seen that would come into play across the globe, not specific to India, but then across the globe. The role of artificial intelligence, natural language processing, machine learning would be very prominent in the way physicians interact with their patients, and healthcare businesses create actionable intelligence from disparate, disconnected data sets. We also believe that pharmaceutical industry will completely revamp the way historically they have done business. Their appetite for information technology has grown dramatically. They're expected to increase their spend on real world evidence, digital therapeutics by 3 to 4 percentage point every year, and the CAGR would be around 8 to 10% from 2021 to 2025. Digital health as a vertical will also grow at 9 to 10% from 2021 to 2022, when the global digital health market's revenue would touch that 160 to 170 billion dollars. We believe that the 5 verticals together can contribute up to 1.2 trillion dollars by next year, and that revenue will only go up and up and up through 2030. In the next 10 years, we believe that digitization will be the number one aspect that board of directors and C-level executives of large businesses in healthcare and outside healthcare will have in their mind. And as a result, cybersecurity, the adoption of cloud for healthcare would also grow tremendously. So with that being said, I'd just like to quickly ask Raul to talk about if he has any question or any concern on the predictions we made.
I think it's all very logical. We believe that AI and machine learning can help doctors to make better decisions. We are not believers that AI can replace doctors. Definitely not. It's not going to happen anytime soon, at least. But definitely, we see that AI and machine learning have an integral part in making these decisions about the basic conditions more accurate. So we are looking forward what's going to happen in next 5 years. We also believe that 3D printing and robotics and medical devices to connect all that to this current healthcare ecosystem. Many people in the world will have much better life, and that will be super exciting.
Yeah, absolutely. Can't agree with you more. So we have 30 more seconds to go. I would like to thank you, Raul Kallo, for your time today. And I learned a lot from your experience and your future plans in India. I look forward to stay in touch with you and potentially have another round of conversation when you kind of make progress in your business in India. So with
Yeah,
that being said,
go
so
ahead.
with that, yeah, with that being said, I would like to formally conclude the session. Thank you, Mr. Raul.
Thank you very much for having me.
Thank you. Thank you.